So, you need testosterone replacement therapy, or TRT. Well, you don't drink this stuff. How do you get it in you? You've got to inject it. What's up, TRT community? Let's help each other. So maybe you've already gotten over that first hurdle of going to the doctor and getting your testosterone checked and you found out that it's low. Or maybe you're one of the ones who hasn't even done that yet. Well, that's where the sponsor of this video, Let's Get Checked, will come in. More about them later. They offer professional and affordable at-home testosterone testing kits, and I've got a new discount code for you. Well, you know that the world of syringes can get a little bit confusing. If you just try to search for a syringe to start injecting with on Amazon.com, let's say, you're going to see something like this, and there's just this whole ocean of different types of syringes and needles and sizes and length of the needles and gauge of the needles. It can be confusing, which is why I want to make this video also. People ask me sometimes what size syringes I use, and so I wanted to make this to help you with that as well. When it comes to the world of syringes, there's really going to be two main kinds that you're going to find. Are there others out there? Yes, of course. But these are the two main kinds that you're going to find. You're going to find one that has a detachable needle like this. Why might you need a detachable needle? Well, your testosterone, its carrier oil that it's in is just that. It's an oil, and so it's kind of thick. And so what you'll find is if you get a fatter needle, well, then you can draw it out of the vial much more quickly. Will this one work? Yes, this is a 23 gauge needle. Will it work? Absolutely. It just comes out a bit slower. And so that's what some people do, is they will use one of these and detach this, buy a fatter gauge, like maybe an 18 gauge, and then it pulls it out much quicker. Take that off and then put this one on for your injecting. The other kind that you're going to find is one like this. It's more like an insulin needle, and you see that this is different because it can't be removed. This tip is just on there. And so when drawing out with one of these, if you draw out with one of these, it goes much slower. Or what some people do is they pull this out all the way, use a needle like this, draw it out of the vial, and then backfill, and then reinsert this back in. There's a little trick to doing it without getting all the bubbles in there, getting the air in there. You have to lean it back and then push it back in. But what's the advantage to one over the other? Well, it kind of depends on what type of injection you're doing. It all depends on what type of injector you are. Now here's the thing. Here's the great thing about being on TRT. You don't have to get married to one type of injection over the other. You can be a glute injector for 6 months and then switch to a deltoid and then switch to quads or whatever. I recommend that you try different kinds to see which one suits you best. So that's the great thing. We can experiment, and that's okay. So different types of injections are going to need different types of needles. What do I mean? Well, a needle like this would be preferred if you're doing a glute injection or a thigh injection. Why? Well, because usually the needles that have the detachable, I should say the syringes that have the detachable needles, usually makes it a longer needle. They won't usually give you a really long needle in one of these because it can't handle it. If it's really skinny, then it usually can't be really long because that will make that needle more bendy and more apt to have some type of compromise to its integrity. So the ones that are detachable are usually going to be a fatter gauge. It's backwards. The lower the number of the gauge, the fatter the girth of the needle itself. So the advantage to the detachable end just means you can usually get a longer needle, which means it can get all the way down into the muscle where it needs to get for a glute injection or a quad injection. And obviously, the fatter the needle is, a bit more pain, but come on, it's not like it's that bad. Now, when it comes to one like this, these little insulin syringes, by the way, this is a 28 gauge by ½ inch. This is what I use for my deltoid injections. This one is a 23 gauge by 1 inch, and this is what I use for my glute injections. You see, I'm not married to one style of injecting either. Some of you can get away with using one this shallow for a deltoid injection. This is only 1/2 inch. I've had people leave comments and say, dude, using one that shallow, does it even get into your muscle, man? That's just like a sub-Q injection instead of an intramuscular. Well, for me, it does get to the muscle. Why? We have to take the way we're built into account. I'm a thin guy. Okay, I don't have a lot of cushion here on my muscle. Okay, it's skin and muscle. I mean, I can even see my veins sometimes. This one works for me when it comes to an intramuscular shot in my deltoids because it gets into the muscle. See, that's what we've got to do. We've got to get this stuff into our muscle. It says for intramuscular use only. However, there are some people that will tell you that they use these and they do a sub-Q injection. They say it works. Some people do sub-Q only and they say it works. So some people say it's got to be in your muscle and other people say, no, it works for me fine doing a sub-Q. I don't know. I'm not a doctor. So when it comes to choosing your needles, you just need to take into account where are you trying to inject? What's your body type as well? Do you have a layer of insulation to get through? Are you big boned, portly, hefty?
Are you heavy set?
Well, then you might need a little bit longer needle to get through that extra layer to make sure that you can get down into your muscle, even if you're doing a deltoid. You might be able to get away with something like this, but you're going to have to make sure that you're at least maybe 3/4 of an inch long to get through. So those are the things that you have to consider, where you're going to inject, how you're built, and then you'll be able to pick a needle that works best for you. But maybe you're not even there yet. Maybe you've not even taken the step to see if you even have low testosterone. Maybe you're just doing your homework ahead of time. Well, that's where the sponsor of this video, Let's Get Checked, comes in. They offer professional and affordable at-home health testing kits, not just testosterone testing kits. However, if you're interested in those, you can click the link that's right here down below, trylgc.com/Cohen25 and go straight to their page of testosterone testing kits. The package will arrive at your house in discreet packaging. You will then activate the kit and you will give the blood sample and you will return it back to them in the prepaid packaging that they provide to you. Once they receive your blood sample, you'll get the results back on your phone within days and you'll have the option for a virtual consultation to discuss your results. How cool is that? Right now you can use the discount code Cohen25 and get 25% off your order. What works for you? What needles have you gotten? And maybe also tell us, where do you buy them from? I buy mine from Amazon and I buy in bulk so that I save. Let us know in the comments below. Thanks so much for watching, guys. I appreciate you. God bless. Peace.